I just recently got a question about chondromalacia. Chondromalacia is generally described as the shredding of the cartilage in the back of the kneecap. So it's in the middle of the knee. You have your kneecap, which protects the knee joint, and right behind, between the kneecap and the bones in the upper leg and the bones in the lower leg, the kneecap is pasted too close, so it grates on the bones. And a lot of times, like I was working with a client, Ricardo, out of Italy. He was a professional rugby player, and he was having an issue with chondromalacia. And there was a lot of dynamics going on with that causes the kneecap to be pasted really tight onto the knee, and every time you walk, it puts the pressure on the back of the knee. The dynamics is there's generally a rotation in the bones in the lower leg and the bones in the upper leg, the relationship of that. The kneecap is real tight to the leg, as well as there's lots of issues with the IT band, which is the iliotibial band, the tendon that goes from your knee all the way to your hip. When that's tight, it creates the tension pattern, it creates the condition, so the kneecap will be rubbing on the bones, and it's extremely painful. I've not experienced that personally. However, Ricardo told me it was extremely painful, and I was taking his word for it that he wasn't spoofing me on that one. So the only way to, the first step in addressing chondromalacia is to create the space in the knee. Because if there's rubbing going on with the kneecap, there's no space for the kneecap to be in relationship with the rest of the knee. We got to create the space first, and then we need to look at the other dynamics that are going on. We look at water, we got to look at nutrition, we got to look at stretching, because the hamstrings are probably tight, the calves are probably tight, and the quads are probably tight. The last thing you want to do in this situation is to exercise, which is strengthening the muscles in strengthening the calves, the quads, and the hamstrings, because the exercise is just reinforcing a dysfunctional tension pattern that already doesn't work, that's already causing you pain. What we're looking at with my program, we got to look at the tension pattern that's going on in the knee, and it's controlled by your nervous system. That's the control center of your entire body. And by teaching your knee to be comfortable, by functioning in a place of comfort, we begin to set up the conditions so your body is able to heal itself. Now, I will have a caveat to this. Depending on the degree of chondromalacia that's going on, the rubbing that has taken place, sometimes there's loose, you could think of it like shredded cloth behind the kneecap. And when that's kind of floating around, even though we've created the space, even though there's no problems, we've created space in the knee joint, sometimes it's important to have an arthroscopic surgery to trim that up so you don't have floating bodies around in there that's causing irritation and more nerves being interfered with, that is still causing that signal to go to your brain that says you have pain behind your kneecap. So that's my approach to chondromalacia. Those are my thoughts, and I believe that looking at all of your alternatives, educating yourself about what's going on in the knee is most important, and looking at a broad perspective and making an educated decision on what's best for your knee as well as the rest of your body.